Hello, everyone. Good morning, good afternoon, good evening to all our participants. My name is Ayata Boagla. I'm the coordinator for the thematic working group on teaching and learning. And we're very pleased today to welcome you all for the final day of the symposium. And with our exciting and experts in the field of health systems and policy research. Before we start the session, I'll be giving an overview on what the session is about and our exciting and interesting speakers for the day. So welcome again to the session. Our organized session for the day is entitled, technical problem. Let's see. Yes, supporting the next generation of health systems and policy researchers. We'll be reflecting on the lessons learned across 4 teaching and learning case examples. Our speakers for the day, you'll be both enjoying their presentations as well as hopefully interacting in the polls and the Q&A. So please feel free to type your questions. With us today will be Whitney, Kingsley, Mairead, Frederique, Camilla, and Bren. A bit of on our working group for teaching and learning. Our group focuses on ways to improve the teaching and learning of health systems and policy research around the world, emphasis on applications in LMICs and disadvantaged population. We aim as a thematic working group to objectively provide an interdisciplinary forum for teachers, students, education administrators, and those interested in HSPR, and collaborate and share information about the scope of the field and educational approaches, as well as building capacities in issues related to HPSR. Our coordinators and co-chairs are Gina. Gina is with us today and will be moderating the Q&A. And Francisco also will be delivering our closing remarks for the session, and myself. Our steering committee members that we'd like to acknowledge with their support and advice. We have been progressing as a thematic working group. So this is me. I'll be moderating and chairing this session. And Whitney would be our first speaker, and she'll be drawing on her expertise as a student in medicine, a master's in global health at Trinity College Dublin, and also drawing from her fieldwork and experience as a food and nutrition officer in Malawi at the Ministry of Agriculture, Irrigation and Water Development. Then from the Masters for Global Health and drawing from experiences of students, we'll be also hearing from Kingsley, who's a research coordinator, Research for Equity and Community Health, Reach Trust from Malawi, will also be sharing his experience within the Perform to Scale program. Together with Mairead, we'll also be reflecting on the partnered consortium itself from a different point of view. And Mairead is our health systems researcher and adjunct assistant professor at the Royal College of Surgeons in Ireland and also at the TCG Centre for Global Health. And from master's, postdoc to PhD, where Dr. Frederique Valerie, which is the director for the Trinity Centre for Global Health, would be also reflecting on context which is a PhD program that she led at the Center for Global Health. And we'll be hearing reflections from Camilla Pereira, which was a PhD student, currently a research consultant at the UNICEF, also within the program of Context. And then we'll be hearing from Bryn Gilmore, an assistant professor from UCD, and Bryn will be sharing her experience through teaching and learning in health systems and policy research at a postdoc level. So we'd be showcasing examples of the different modalities, methods, and ways of teaching and learning in health systems and policy research throughout the continuum of postgraduate education, from master's, PhD, to postdoc. And of course, we encourage you to join our thematic working group on teaching and learning, and to contact us directly through these emails. So from that, I'd like to welcome our first speaker for the day, Whitney, and giving her insights on health systems and policy research and reflecting from a student perspective, but yet from an implementer, from an LMIC. Over to you, Whitney.
Hi. My name is Whitney. I'm a recent graduate from Trinity College Dublin, from the program of Masters in Global Health. And today what I'll be sharing with you all is my experience going through this course. So I had first slide, please. Thank you. So I'll just basically go over the modality and the methods that I employed in the Masters in Global Health program that I think are really important in learning HSPR. So firstly, I'll talk about the course content, and on the top of the list is a course in health policy. I think this course does an excellent job in helping us understand what happens behind how policies are made. That is, understanding how different governments choose the health systems that they choose and employ. And although this class is full of varied backgrounds, so in the end, everybody feels like they have a part towards health workforce. You feel like you can do something in health-related field. And secondly, another important module is in health economics. So this, in a nutshell, I think does an excellent job in helping students understand who makes the decisions about what to finance and when to finance. So in a world where there are a lot of interventions, this course helps in helping us understand the prioritization process and all the dynamics behind that. So also it capitalizes on the nature of students. As it is, it enrolls students from different backgrounds. So the real examples that I employed are very beneficial in that. Also, another component that is very important is global health networking. So I think the course helps students network, not just within themselves, but also from current implementers. So we had a lot of sessions where implementers came and made us understand how things are happening. And I think this was also a great opportunity where a lot of us could pick research topics that are relevant and could also see how research findings turn into interventions. And also another very important component of this course is that the course content is very relevant across regional and country borders. So you find that it tackles things that are applicable in almost all the countries. For example, topics like nutrition, NCDs, maternal and child health, as well as others like mental health and things like that. So again, this also capitalizes on the different nature of students, not just for cultural exchange, but also for real-time experiences, having different expertise. And also another very important component of this course is the research experience, where you have a mentor that really takes you through the research process, and not just mentioning on the student supervisor ratio, which is well mentioned, well maintained, but also the mentorship. And also very important is the support that you get beyond just the Center for Group Health, but other departments like the IT, the library, in helping all of us use the e-libraries and referencing and all the things that are very important in research. So I think that was very good. And coming back to Malawi, where, as I had mentioned, I work as a food and nutrition officer. And in the face of COVID, I'm part of the district team that is responding to COVID. So I've seen the importance of accurate information and the challenges that wrong information presents in emergencies like this. So being part of the team that is disseminating COVID-19 messages, you find that the community is already flooded with a lot of fake news information and things like that. And also something that I've come to appreciate is critical health analysis, where there's a lot of competing needs that need funding. And then, but with the face of COVID, you still have to sit down and say, which one can we forgo? Although all those are important. So being part of the district rapid response team and creating plans has helped me understand that. And also something that I appreciate up to now is the networking. So conferences like these, also a member of Women in Global Health Malawi chapter, which I think are very important in terms of sharing and accessing information, especially in the face of COVID, but just generally like that. So in summary, I would say that this course, just looking at the post content, the coverage, the networking, the diversity, the research experience, in the end, does a good job in bringing out a capable and a connected researcher that is very important in feeding into the health systems research strengthening initiatives. Thank you very much.
Thank you, Whitney. Thank you for sharing. Thank you for sharing your experience. And indeed, it further enlightens our discussion to come and makes us think, are we, as facilitators, as implementers, as instructors within the area of health systems and policy research, are we preparing for the future, especially at times of COVID-19, where all our health systems, irrespective of the geographic location, being high, middle, or low income countries, have been and are being tested. So thank you for that. I'd like to welcome our next speaker, Mairead, who would also be giving and sharing with us insights from her experience in a consortium performed to scale. Over to you, Mairead.
Thank you, Ayat. I'll just share my screen. Can you see it? Yeah. Thank you very much. So the next section is about how we support researchers through a consortium. And this is drawing on the case of Perform to Scale, which is a a 9-partner, 7-country consortium, and I'll just talk a little bit through how we support our researchers within that consortium in the work that we do. So just a little bit of some background information. Its focus is on strengthening leadership and management. So very much on developing those skills, and specifically working with district health management teams. And these take place in Malawi, in Ghana, and in Uganda. And the focus is on a decentralized context, with the assumption that, or with the understanding that there's greater decision-making space in decentralized contexts. So in working to strengthen leadership and management in that setting can enhance and improve work practices, and in turn healthcare and health outcomes. So the management strengthening intervention is implemented with district health management teams in partnership with them through an action research cycle. And then that the focus is also on scaling up. So that's both expanding the program geographically through different districts, but also that it's embedded into the political and administrative structures within the Ministry of Health and other relevant government structures. And so the overall aim then from a research perspective is to develop and to implement and validate a framework and strategy for scaling up this management strengthening work. So really researching how scale up works, the implementation and validation of that. So just a little bit more background information that with these various countries, we have the lead partners at Liverpool School of Tropical Medicine in the UK, so working on project management, comms and stakeholder engagement. And then with the implementing countries in Malawi, Uganda and Ghana, and then that we have partners in the Netherlands and in Switzerland leading on the process and outcome evaluations of scale up, and then the partners in Ireland who are leading on capacity strengthening. And so the work of these different partners and how they bring together different areas of expertise in order to work on the implementation and research related to management strengthening and its scale up. So a little bit on the structure, and I suppose that the setup of this structure is motivated by this by the ability to bring together the research capacities of the different members and to support the members in their research. So while we have the different countries leading on different work packages, there is a project management committee through which all decisions are discussed, agreed each month, so that there's full transparency and essentially buy-in that everybody is contributing to the discussion of the various decisions related to their work, and that there's a proper awareness of what's happening across the consortium through the transparency of the project management committee. There are also paired partnerships, so different pairings of different countries, three pairings, and with a focus on being able to exchange expertise within the paired partnership too, and also to allow this kind of cross collaboration with different areas of expertise and topics. There's annual consortium workshops of about 2 weeks in length, so often focusing perhaps the first week on a particular topic like implementation, perhaps the second week on research, and that again it's really with a focus of bringing everyone together in person, of course prior to COVID, and they've become virtual since COVID, but again with the focus on being able to share experience, to learn and develop, the research scope of the consortium, which is of course moving, through the research program with each year. And then, in the interim throughout the year, that there's a series of workshops, webinars, working groups that have been set up with reference to specific topics, and then webinars that are held that can both be related to experience sharing and also through perhaps training on some particular technical skills. So for example, training on political economy analysis and doing gender analysis, so topics such as that. So, the focus around implementation and research, but really that there's this structure in place that facilitates a good deal of collaboration across the work of the consortium. And with the lessons learned in relation to supporting researchers, I guess that the importance of robust structures to ensure support in research, and really that point about transparency, I think looking at who's proposing paper ideas and discussing them, and the invitation being open to all members to take part in a paper if they so choose, so that there's a chance to really share equitably a participation in the research processes of the consortium. And so that every piece is proposed, discussed and approved at PMC. It's not a more kind of hidden or informal arrangement. And then the importance of opening up and supporting the writing and publication process through workshops and collaborative writing workshops and through buddy systems, so that there's a focus on how writing can take place and space for that. And I suppose attention to who has particular strengths, and drawing on the strengths of various consortium members, but also facilitating the development of skills in other areas that some members might need to develop skills to a greater extent. And then ensuring space and time for discussion and decision making. So this is important, moving slowly with a lot of opportunity to discuss the various pieces of work that are coming up. And so taking stock of the development of the suite of publications over time, and I suppose again with the emphasis on kind of bringing everyone along through the decision making process and the writing process as the work takes place across the years, and bringing all members in. And so it's not perfect because there's a high workload associated with implementation, of course. And so it is again about trying to ensure that those who are involved in implementation have the opportunity and the space essentially to be involved in the research side at the same time. And I suppose just in terms of research equity, if I can I think I left a poll question actually though. I asked, can I access that here? I don't know if I can. I'd asked about a poll question. Maybe not. Okay, it was a poll question related to what any audience members might have thought about supporting the writing process, but we can possibly even come back to it at a later point. Okay, and then just a quick reflection on the negative and positive effects of COVID. So I suppose obviously with COVID, everything has moved online and implementation has been affected. There's some anecdotal evidence that the DHMTs are using management strengthening ideas to respond to COVID. And then I suppose some changes from the research side, incorporating questions to the final evaluation so it can be more retrospective. And then moving the sessions online, they've become more virtual, and then rotating the responsibility for the organisation of those sessions among the partners. But then looking, towards the end now, the research methods and tools for data management, and like moving towards the end of the project with validation and stakeholder engagement and kind of the organisation of those tasks online, but as well, of course, moving to the end with the project development and paper development with the research findings from implementation across the 5-year programme. So that's it. Over to you, Ayat. I'll pass back.
Thank you, Mairead. Thank you for sharing your experience, and indeed consortiums, and especially in a field like health systems and policy research between the geographical northern and southern hemisphere, dealing with different institutions, adapting and adopting different implementation methods in light of COVID and the different challenges that we all know exist and arise in the field in our day-to-day activity and work is definitely enlightening. So thank you for that. We look forward to our Q&A later and to discuss the results of the polls also. I'd like to acknowledge King. King was also part of this presentation, but unfortunately he isn't with us here. We hope he joins at a later stage. And from our experiences in a consortium and a postdoc, then we're going to Camilla and Frederic. So I'd like to give you the floor to also reflect on how health systems and policy research, teaching modalities and experiences are showcased in stable and unstable conflict-affected states. Over to you, Camilla.
I think I'm going to go first, if that's okay, Ayat. Thanks so much for the introductions and to my fellow panelists as well. So I'll be presenting with Camilla today. I'm going to start out and just give a broad overview of the context program as the PI and talk a little bit about how we organized our training for the PhD fellows. And then I'll hand over to Camilla as one of our 12 fellows to share her experiences on the program. So I'm just going to share my screen. Hopefully everyone can see it now. Okay, so the context program was a Horizon 2020 funded Mary Curie Actions, which fell under the Innovative Training Network. And it was a effort between a number of different partners, which the language of the European Commission differentiates between academic and non-academic partners. So I apologize if I fall into that trap. Of course, our NGO partners and our government partners are not necessarily non-academic, but they included the Danish Children's Centres in Denmark, Sparasi, which would be Ireland's National Centre for Torture Rehabilitation, the Police Service of Northern Ireland, the Danish Red Cross, and more specifically the Psychosocial Reference Centre hosted by the Danish Red Cross for the IFRC, the Northern Ireland, the Dublin Rape Crisis Centre, and 3 academic partners, Ulster University in Northern Ireland, the University of Southern Denmark, and Trinity College Dublin. And a fundamental rule of or aspect of the innovative training networks, which I think makes them quite unique, is that you actually have to spend as a fellow 50% of your time outside of the academic setting. So all of our 12 fellows would have spent minimum 50% of their time outside of academia in one of our partner organizations or one of our 6 partner organizations, and this is known as the mobility rule. So in designing this program, we essentially had a number of training work packages, which broadly translated into local training, network-wide research training, and then what we termed these kind of more transferable skills training. And again, the purpose here was really to try and equip the fellows with as many skills as possible to be able to work across academia and non-academic settings. So in the first instance, the local training is really what took place in terms of each fellow and their individual research projects. So this was really a combination of training that would have taken place within their academic and where they would be registered. So for example, Camilla was registered in Trinity College Dublin, and then as part of the mobility rule would have spent time both in the PS Centre in the Danish Red Cross, but also in the Colombian Red Cross, which she'll talk about as well. Within these network-wide training packages, we had a number of different things that were happening, but essentially what we divided it into in terms of the research were these kind of principles of social and qualitative research. So all 12 fellows would have come together and received training in realist methods, actually taught by Bryn, participatory action research, implementation, occupational research, as well as case study approaches. Of our partners in the Dublin Rape Crisis Centre teach some of the fellows around kind of interview skills for particularly traumatized groups. Under psychotraumatology, these would have been, I suppose, I should have mentioned, sorry, that the program itself was really kind of focused on psychological trauma or groups that were at high risk of psychological trauma. So these were first responders, so humanitarian aid workers, for police officers, victims and survivors of childhood and gender-based violence, as well as refugees and asylum seekers. So in terms of the academic or theoretical underpinnings of psychotraumatology, this would have also been taught as part of the research training work package. They also received, I suppose, advanced quantitative analysis skills, in addition, some qualitative analysis skills that were also predominantly delivered by our partners in the University of Ulster. In terms of the transferable skills, then, these included things like communication, social entrepreneurship, teaching and learning, networking. So the fellows would have had the opportunity to travel quite a bit to different conferences, and really try to, I suppose, network both within an academic setting, but then also travel for things like dissemination to other partners, and also engage in some media and advocacy work. They also would have received some training in kind of policy communication, so how to write a policy brief, and so that they can apply some of these skills within the non-academic sector. And a lot of these transferable skills were co-taught by both academic and non-academic partners. Go through every single one of them, but for example, the Red Cross would have done a lot of work with the fellows on media and advocacy, social media, translating findings into practice practice, then some of the academic partners would have helped, or I suppose done some of the training around writing and dissemination of research findings, poster conference presentations as well. And then there was a big teaching and learning component as well for the fellows. So the outcomes, so this was a 4-year program, but the fellows are asked to complete this in 3, which most of them did, which is actually quite a challenge for those of you who have the experience of trying to do a PhD with primary data collection in 3 years. But as a consortium, we produced over 200 academic outputs, and this is across different peer-reviewed publications. We put together a special issue with the fellows in the European Journal of Psychotraumatology. They would have given a number of oral and poster presentations at various conferences. And there's also an edited context book, which is really about kind of the do's and don'ts of research and practice, which they would have contributed to. In addition, we really had a strengthened research partnership across the consortium members. Many of these partnerships actually continue today, which was a great outcome of the project or of the program. And then research findings have been integrated into various policy briefs, white papers, and developing new staff care policies, both within the police service and within the Red Cross. So I'll hand over now to a more candid first line account of the context program. Thanks.
Thank you, Fred. So yeah, as Fred said, I'm one of the context fellows, and before starting on the context program, I work as a research assistant in one of the partner organizations, IFRC, Reference Center for Psychosocial Support, and then through my research, I collaborated with the partner organization, but also with the Colombian Red Cross, who was where I collected my data. And currently, I'm working as a research consultant at UNICEF's Office of Research, and I do research on mental health and COVID and on social protection programs that UNICEF currently has. Fred, I think you have to move it for me. Can you move to the next slide? Yes, so my research focused on studying this type of simple low intensity or low intensity psychological interventions and seeing whether people that don't have a background in mental health, in this case, Colombian Red Cross volunteers, could learn them and apply them to, in this case, Venezuelan migrants and refugees. And as part of this process, I studied the cultural adaptation of this intervention, but also how it worked in this context and the implementation within the Red Cross. Fred, can you move to the next, please? Excellent. So I'll touch on some of the advantages of this program. So first of all, one of the most exciting things for me from the beginning of the program was knowing that I was working on some kind of research topic that was demanded by the organization that I work with. So I knew that my work was going to be clearly useful to the organizations after it's finished. And this was a big incentive for me. In addition, this type of consortium allowed for me to collect primary data in a context where it might have been difficult to access. It was in a part of Colombia that is affected by the armed conflict, so it provided the ability to research in a more difficult context. I think having multiple supervisors was definitely an advantage in terms that they brought in very different experience, not only academic experiences, but also non-academic ones, as Fred said. And of course, the generous funding for training, fieldwork, Living Alliance, research expenses that allowed to do this type of work. But in addition, it allowed me to explore things beyond the topic I was studying. So as Fred said, there were very different types of training included that, so I got to learn about methodologies that I didn't get the chance to use, but as part of my PhD, but that I could use in other contexts as well. And of course, the ones that I ended up using. And of course, the non-academic experience was essential, and as it allowed me to learn about the work that was being done in this context, and of course, network for when I finished my PhD. But of course, it gave me these soft or transferable skills at the same time as acquiring the more academic skills that you need to complete a PhD. In terms of challenges, I think you could say that one of the challenges, or although it is also an advantage, is this conflicting responsibilities of being based in a so-called non-academic context, in the sense that I had the opportunity of getting involved in other projects, but this also provided some distractions from doing the PhD as well. But I think it's in fact also another advantage. Of course, there are mobility challenges, and the level of mobility that is required from this type of program is not really for everyone, and it brings all these issues related to visa, taxes, and of course for the organizers and Fred as the PI, I imagine it brings a lot of paperwork and difficulties on that end. I think it could be seen also as a challenge that when you're doing so-called implementation research in this context, you might want to be seen as external researcher, so you get these like insights that might not be given to a person that is seen as internal. But in this case, that wasn't possible, since in most cases I was embedded in the organization. So this might, although it offers some good things, it might pose some challenges for the research as well. I think another challenge could be the fact that this type of program has a lot of requirements that are attached to the grant. So a lot of deliverables that are not necessarily the deliverables of the PhD program. And I think this presented some challenges in the sense that we had to complete these two very different pieces of work kind of at the same time. And I think the different work environment should be considered in the sense that towards the end of the PhD, if we're based in a non-academic institution, this is not really ideal, because these institutions tend to be more and more dynamic in terms of like for concentration, it could be difficult, especially towards the end of the PhD when you're like kind of like writing and really need a high concentration. Yes, and some final points. I would say it's a very unique opportunity, and I think it gave me the possibility to kind of speed up my career, in the sense that I was gaining this a big amount of academic knowledge, but at the same time I was getting professional knowledge as well, and this was fantastic, of course, for my career development, as well as should also be considered that the kind of like prestige of this type of program also contributed to this, and the amount of work we all did was really beneficial in terms of building up these experiences. And finally, I guess one of the most unique parts of it is seeing this collaboration between non-academic and academic institution, and seeing this type of like action research happen, and how this collaboration it creates so many benefits. I think that's it from me, Fred. I don't know if you want to say some last points. Otherwise, we go to the next.
Thank you, Bren. Camilla, thanking Bren in advance. Thank you, Frederic. Frederic, would you like to add any extra thoughts or words before we go ahead with the program?
No, sorry, my internet is pretty bad, so I don't know if you caught the end of that, or did I cut Camilla off in terms of the presentation?
We didn't hear you.
Yeah, no, it worked well, Fred.
Okay, sorry, no, my internet, it cut out. So I just wanted to know if everyone got the end of that. Okay.
Thank you, Frederic. Thank you, Camilla, for showcasing a different, a variety actually of teaching modalities in health systems and policy research. We're here. We see not only North to South partnership, and we don't, and just a quantitative, but also qualitative implementation research, different modalities, different stakeholders, which is quite interesting, interdisciplinary, multi-stakeholder in its best forms between academia, NGOs, INGOs in conflict and stable states. And I must say it was a pleasure seeing and observing the process while it was happening. So kudos. Thank you. I'd like to present our next speaker, King, who will also be reflecting and sharing his experience postdoc and Perform to Scale in continuation for what we heard earlier from Mairead, but from a different perspective. So over to you, Kingsley.
Thanks so much, Ayat, and everyone. My apologies. I had some challenges with my internet, but I hope I'll stick around, I think, to the end. So very briefly, I just want to share with you some experiences, I think, from the field with the coming in of COVID-19. And just to highlight a few examples of the steps that we undertook in terms of being responsive and adaptive to the emergence of the pandemic. And also I'll share with you a few lessons that we've learned. I think as we might all be aware, I think COVID has created a major interruption to programs across the globe. But I think despite the disruption, we seem to be also getting some gains, I think, out of it. And I'll share what we mean by that in terms of our experiences in Perform to Scale. And then I'll also share some lessons in terms of learning and teaching within the field of the systems research and policy. Next slide. Yeah, so I think we experienced some delays of failure of our program. As you might see, I've jumped a background, which I believe Mairead had already shared with you, but this is an intervention that is happening in Uganda, Ghana, and Malawi. And so with the emergence of COVID-19, there were some delays, as you can see from the slide. But we made some efforts to make sure that we remain in touch with our stakeholders that we are working with. And so we resorted to using emailing, WhatsApp groups, as well as phones. I think COVID also affected the timelines of our project. And also we noticed that resources, time, and attention from the district health management teams that we are working with started being diverted to COVID-19. But also I think the huge political influence that COVID-19, I think, has brought on the DHMTs itself, I think also affected the decision-making of the DHMTs, because the pandemic came midway the intervention. And so they had to make decisions in terms of continuing with the intervention, or they could now, they should go along the directives of government according to the pandemic dictates. But also, I think we saw that some health workers were also being infected with the virus, and then they were experiencing a lot of stigma and discrimination as well from the communities. Next slide. Generally, with the delays that we experienced, it meant that I think the intervention was halted for a period of time, and so we were interested to learn if the managers took with them the knowledge and the skills that they had gotten from our intervention and apply that to what they were experiencing with the coming in of COVID. And so we've seen some evidence of that across the countries now, Malawi and Ghana and Uganda. For example, I think we learned that they took the problem solving skill using the problem tree analysis each time they experienced or they faced a challenge as a result of COVID, and then doing that analysis to understand what is causing what, and then they could come up with their solutions. And we've heard very good stories of client satisfaction. We've heard good stories of teamwork, as a result of that application. But also, I think their attitude didn't change much, because we thought they would forget completely about the program, but they were eager, to resume the activities that they had planned to implement. In terms of the implications, I think the negative ones, I think there is need for engagement plan, which we have already done. But also, we think positively, the DHMTs are more likely to use the skills and knowledge that they've gotten from the project into other programs and challenges, as we've learned with the COVID-19. Next slide. That may end. I think that's my final slide. Thanks so much. I had to be very quick. I've just joined midway, so I wouldn't know where things are. Thanks so much for your attention.
Thank you, King, and we're glad that you were able to join us. Hopefully, we'll be receiving questions and answering that in the final part of the discussion. So after sharing your insights and experience on the other end as an implementer in the field, dealing with the different difficulties that rise, then we'll head off to Bryn, who'll also be sharing with us her insights and her experience as a postdoc. Over to you, Bryn.
Thank you. Just let me share my screen. So there we go. So just really quickly, hi everyone, my name's Bryn Gilmore. I'm currently an assistant professor in University College Dublin, but I actually recently finished my postdoc at Trinity College Dublin. And so that's what I'm going to be sharing about today. The postdoc, I believe, helped me get my new role, switching universities within Ireland, which, if you know Ireland, there's not so many. So it was nice to get that opportunity. So I'm going to quickly just go through the fellowship that I had. And so I was lucky to receive an individual fellowship called Caroline, but it stood for the Collaborative Research Fellowships for a Responsive and Innovative Europe. And it was a Marie Curie individual co-fund fellowship. So it was funded by the Marie Curie under Horizon 2020 and also the Irish Research Council. So this scheme, this specific Caroline scheme has ended. They did 3 iterations of it, and I was in the first one in 2017. But Marie Curie does a lot of these types of co-fund postdoctoral fellowships. They just released the results of people that were successful in some co-fund ones, I think last week or the week before. So if you are interested in postdoc work, just because this one's closed, a lot of their fellowships are quite similar and the structures are very similar. So this one was specifically funded researchers from any discipline, but you had to conduct work on the SDGs. And being a global health researcher, with my PhD was, doing community health and health policy and systems research. It just aligned really well. And also I mostly do like implementation science, operations research. So the fellowship itself, you had to have an NGO or an international organization as a main partner, and you were embedded with them for the majority of the fellowship. So it was really a great opportunity for me to further kind of align how I do research and what type of researcher and academic I want to be with this fellowship. So for this one, there were 2 streams. There was an international one. So if you were essentially based in Ireland, you had to do the international one. And that was 3 years. With 2 of those years, you're on secondment to your partner organization. So that non-academic NGO partner organization. And then you return for your final year to your host organization for your university. Now, if you were coming into Ireland, but if you're familiar with Marie Curie, and Frederic talked about this a bit, they're really big on mobility. So you couldn't be a resident in Ireland to do the Irish one. You'd have to be coming into Ireland. And that was a 2-year one where your partnership agreement was a little bit different. And the key features of this training fellowship was like they really focused a lot on individual training, so facilitating skills beyond just academia, preparing researchers for careers outside academia if they so choose. It was individualized, so this was my project. I got to develop it, propose it, draft it, and then apply for the fellowship with this project. Very interdisciplinary. And then the real kind of key features are that international collaboration, mobility, and then the secondments. So my specific project, I won't talk you through it much, but I do mostly community engagement and kind of community health systems research, mostly with NGOs. So I leveraged this and partnered with an organization that I had worked with before. And we collaboratively designed this research project where I spent 2 years in northern Kenya with the NGO, conducting a realist evaluation on one of their community engagement programs. So I got to be really, really embedded. Similar to what Camilla said, luckily you get the opportunity to really get involved in a lot of other types of work. So helping them write grant applications and looking at other programs and really being exposed to kind of that side of I guess the implementation side. And so specifically to me, so for me, my secondment was to this international NGO for 2 years in Kenya. And I did an additional secondment to the WHO for 3 months. So I also kind of got that nice exposure to that level of systems as well. So I think there were many benefits to this type of fellowship. First, I greatly recognize the privilege to have done this type of fellowship. It was, you know, a lot of work to put in the application and very competitive, but also not everybody's able to, you know, do such a long time fellowship and move away. But I think one of the main things was it really was designed to align to my own career trajectory needs. So since I designed it, not just the research was designed in collaboration with the partner as well to make sure it fit their work and what they needed, but the training plan I got to design and the schedule and all those types of things. So I really got to kind of tailor my training and my learning to what I thought was best for my career instead of having to fit into somebody else's postdoc. So the training, I got funding for that training as well. So I think a lot of times you do a position or a postdoc, but the funding's not included to do these extra trainings. So I got, you know, flights to do gender analysis training and online other training, certified in some implementation science courses. I really got a lot of exposure to the kind of other side of health policy and systems research. So the implementation side, which I think we don't always get, and it greatly enhances our ability to conduct this research, in my opinion. So again, the UN system, I gained valuable relationships. I still work with the WHO on community engagement work because of this partnership that I developed. So it's long-term. And then you really get to see health policy and systems research in action. It's not just, you know, I got to be there and watch the program, not only this program, but the other programs, again, as I said, work on grants and see the other side of that. It had a lot of flexibility because, you know, it was a 3-year kind of, the main thing was obviously to do the research, but there's a lot of flexibility in that. So working on other projects. And the support, so there was no cost to the NGO. They were provided with a small logistics kind of support for like office space and stuff, internet. And then all the research expenses, my salary, everything like that was built into the fellowship. So they had no or little cost to host me, and hopefully it was mutually beneficial. I realize I'm only speaking from my perspective here. But there are some cautions. So similar to what Camilla said, the mobility requirement of this fellowship might not be conducive to everyone, especially this one where you you're obliged to spend the majority of the 2 years in your host country, and if you with your host partner, and if you break that, you could lose the fellowship. So I think, you know, if people have family commitments or caring commitments, it could be really difficult. Also the requirements, so I'm actually Canadian, not European, or not a member of associated countries. So Marie Curie, you're either European or associated country. So I needed to show that I had 5 years research experience in the EU, along with kind of the other requirements for the Marie Curie postdoc fellowship. And then I think just personally, I had just come out of my PhD. I was actually really lucky to be successful in this grant before I had submitted my PhD. So it was quite a tight time frame. And I just think it was a little tiring to go from one very individual led PhD project to another one that was pretty much the same time frame, and you have your NGO partner, but obviously you are the one kind of leading and having to really steer that research. So that kind of team research approach was a little missing. And you really need to kind of embed yourself into these new environments, and maybe that doesn't work for everybody as well. And I would just say these pre-connections with partners are very important. I was lucky to, as I said, have known the NGO and known some people there before. I had also spent time in Kenya and a lot of time in East Africa before, so it made it, I think, a little bit easier. And then the timeframes. So I think everybody knows in international research, and especially, you know, different ethical requirements. So, you know, 3 different ethics levels in Kenya, but you still have to stick to that 24-month time frame. So it gets you know, timeframes can still be tricky, even though it was quite a generous time frame to begin with. And just in conclusion, I think if people were to take this type of fellowship forward, or how to take these types of fellowship forwards. So I was fortunate to have like an academic mentor, a secondment mentor, and a placement mentor. So and they all were in touch. So I definitely had those 3 different levels of supports. The grant itself was over about 200,000 euro for the 3 years. And that included my living allowance is what they call it, which is adjusted to the country that you're working in. So Marie Curie applies a country coefficient, mobility allowance, so my travel, research expenses, training activities, and as I said, some additional supports to the NGO. And I think you also need, as I said, to kind of have that level of independence, but also in-country support. So you do really need your partner. It would be really hard. I think a lot who have done research not in their home country understand how much, you know, facilitation and support you do need, regardless of how independent of a researcher you are. So, you know, things like access to program participants and logistics and support, you know, for the visa and housing and facilitation and travel. So, well, it's a extremely you know, attractive and very fortunate individual fellowship. It also does require a lot of additional supports that shouldn't be taken lightly. And that's that from me. So thank you very much.
Ruben, thank you for sharing your experience as a postdoc student. Reflecting on the practicalities and the different opportunities and sharing your experience with us. And with that, I'd like to hand it over to Gina. And Gina will be moderating the Q&A. So I'd like to ask all the speakers to open their cameras. And hopefully all of the participants to also, if you haven't yet posted a question, then please feel free to. So over to you, Gina.
Okay, thank you everybody for the presentation. It was very interesting listening to all the experiences that was being shared. I haven't received any questions from the participants yet, but I had some questions going through my mind whilst listening to the presenters. And one of that kept coming to my mind is to the fellows, I think Camila and Bryn, and that has to do with considering the off-campus activities that you have to do, the external mobility or international mobility you had to, which is very interesting because of course you are embedded in the site. But how does that work out for you in terms of the time frame within which you have to finish your program? Did you find that quite difficult, or did you find it was easier to work within the time frame? Because I can see if you are on the field, of course, there will be so many unexpected things happening. And I'm wondering if that actually you experienced that, and if you could speak to it, just in case somebody is listening and they want to adopt it, because it's quite interesting and it's something that, you know, I find it quite attractive. Then the other question that I had for Whitney, I was wondering whether she could speak about whether you can speak to the how, whether you what are some of the challenges that you faced in terms of being responsive during the COVID-19? Because you were speaking about your experience in doing the training program as a master's student and applying it immediately because of COVID-19. If you could share some of the highlights and some of the challenges that you had to, you were faced with that led you to be responsive to the situation. And I think that would be very interesting, because sometimes we want to apply what we've learned, but we need to be innovative around them. So if you have any of these experiences to share, that'll be useful. I think I'll stop there for now, and then hear answers that will come up.
Camilla, do you want me to?
Go first, yeah.
No, I think that's a really important question. I think from my perspective, the fellowship maybe wasn't as prepared to have people. I was one of the only ones that went quite global health and did work kind of with, you know, in a different context in sub-Saharan Africa. A lot of people maybe went to other countries in Europe where ethics might be a bit quicker. So I don't think it was very responsive to that. So I did struggle with the time frame. And then also, I think Camilla also said, you do get kind of caught up in wanting to work with the programs and you know, go to other sites and kind of just not just do the research, but really kind of embrace as much of the partner's work as possible. So it was slow. It was a slow start for me anyway.
No, I agree with you, Bryn. I think, but I still think it adds more than it takes out. And if the people you're working with are conscious that you're doing a PhD, that's also very good. And in terms of I was doing implementation research, so the knowledge I was acquiring by being there was, I would say, was very valuable, and I wouldn't have acquired it otherwise, I think.
Okay. Whitney, do you want to come on with your response?
Oh, yes, please. So coming to the challenges, as I mentioned, I work in the agriculture sector, where there's a lot of interventions that are not directly on health. So it's a field that works on food production and marketing and things like that. So coming back and working into that field and then having to respond to COVID was something that was tricky in a bit. Firstly, in terms of resource prioritization. So health is not something that comes directly in the Ministry of Agriculture. So working with a team that it's like you're pulling limited resources in different directions, but yeah. And also just working in that nature where usually work with farmers in communities where you need to go and visit them. So with the COVID restrictions and the precautions, it was quite challenging. And also working in the team that is disseminating information. So access to information in the face of COVID has been mostly virtual. So with the farmers, it's something very difficult. They need to get the information, but they can't access most of the virtual platforms. So those are some of the things. We had to use local radio stations and things like that. So that has also been a challenge. And also just generally working, COVID has, I would say, attracted, I don't know how to put it, but it has been a diverse team responding to COVID, not just the health professionals. So even at the district level, not just within my sector, but just at the district level, trying to sit in a team that is totally responding to COVID, but with different interests, has also been something that I've learned a lot from. It has been challenging, but yeah, it has been worth it learning from that also.
Okay, great. Mary, I had a question for you actually. Being an academic who is running the some of the fellowship programs, with it, I think that's something that we experience in our institution. Actually trying to create continuity in terms of how students needs to follow some of these structured programs was a big challenge for us. I'm wondering if you faced that in your fellowship programs, and if you can speak to how you manage those kind of challenges or difficulties or probably disruptions that have happened, and what did you find useful that others can also take home as ways of reflecting or adapting to some of these challenges?
Thanks for your question, Gina. I'm afraid though, I didn't run the program actually. I'll have to hand over to Frederic Valliere on that one. So I was speaking more to Perform to Scale itself and the work in that consortium. So Fred, no, that's okay, not at all. But I think on this one it's best to pass over to Fred because that's the area of work that she was involved in. So she'll speak to
Sorry,
that.
Gina, can you just repeat the question? My connection is very bad, so I keep dropping in and out.
Right. So my question was, how did you maintain continuity during when COVID came in? We found that we struggled a lot with creating continuity, especially when the program is organized between off-site, on-site activities. Or some of the institutions had to close down and all that. And I'm wondering, as a facilitator or somebody in charge of some of this program, how did you manage it? What are some of the lessons that people can take away?
Yeah, so I mean, we were very lucky because actually the grant was coming to an end when COVID came in. So essentially, we had some deliverables that we had to postpone. We did get a no-cost extension on the grant, but it was mostly related to the final context conference, which unfortunately we had to have virtually rather than in person. But none of the fellows were actually traveling at the time or were under the mobility rule because they had essentially, most of them submitted their PhDs. It also meant that a lot of the vivas that we held for the PhDs, actually all of them had to be held online. So we couldn't have the face-to-face vivas, which would be more traditional in terms of PhDs. So I suppose minimal damage in terms of what could have happened. The Perform to Scale program has been, however, significantly more affected, as I'm sure King can attest, in terms of the field work and being able to travel for data collection and whatnot.
Okay, thank you very much. I wonder if there are more questions from the participants. At the moment, there isn't none. So I'm just going to go through the
There is
live
one
polls.
question, Gina.
Okay, go ahead.
I don't know if you can see it, but Farah wrote a question.
I can't see it from my side.
I'll read
it. Do you want to read it out?
I can read it down. Farah is asking, is there any equity training integrated into your training programs? For example, training on equity principles and practice, including research methods. I wasn't able to be here for the full session, so I apologize if you are already speaking about this. Okay, that's the question.
Okay.
From my individual, and yes, I integrated more gender. I wanted additional gender and equity training, so I built in training programs for myself on gender analysis and gender sensitive research. Again, that was something that I was able to build in because it was an individual fellowship, but maybe other people can speak to the broader ones.
Yeah, if I can speak to, I guess, perform to scale and also my present place of work. I mean, you know, I suppose the equity was built in through the structures. You know, even having this transparency around project management and discussions on publications, you know, and really with the aim of having a very collaborative and transparent process through which publication will be organised, which isn't always the case. You know, so that structure was there for that purpose. And this doesn't relate to perform to scale, but I mean, I finished up with perform to scale last year, but we were designing this at the time, hence the participation now and speaking about the writing workshops and whatnot. But within the Institute for Global Surgery, where I now work, we've set a metric actually that 33% of all publications should be first authored or last authored by our partners, you know, from low and middle income countries, specifically in order to try to address these inequities in publishing and in papers, which are very much linked with power, essentially, you know, and promotion and whatnot. So it's an effort to, like, it's an outcome focused indicator, obviously, and the process through which that's achieved then is another part, you know, but, you know, really in terms of, I suppose, supporting all researchers and the involvement in publications I'm focusing very much on writing here. I guess, you know, Bryn, you were speaking about gender equity there. It comes from a whole host of different angles. You know, it's a very broad-ranging concept. But just to add that comment in relation to publication itself, you know, because so much is caught up with publication in terms of holding power.
If I can add to you, Bryn was heavily involved in developing some great guidelines. I don't know, Bryn, if you want to talk about those. As part of your, well, experiences both on the master's and the PhD.
Sure. Just really quickly, I guess a group of us students, when we were doing our PhD, a lot of people going abroad doing research. So we developed ethical guidelines for overseas research. That luckily the context program that Frederic did, they got disseminated towards, and just around how to conduct ethical, equitable research for students, especially when I think a lot of students have the experience of maybe their supervisors or their institution don't enforce those types of principles. So kind of giving a guide to students to be able to say, but, you know, I need a partnership and I need supervisor and I need, you know, this type of training and stuff before I go. So.
Okay, thank you for that responses. So I'm going to go quickly over the poll results before I hand over to Ayat and Francisco. So with the first question, which is about how have you managed to adapt to your interventions in the wake of COVID-19? I think the most popular one is 75% said yes, meetings and workshops, and 25% said using social media. Then the second question that poll question looks at what steps do you think is the most important for supporting researchers towards equitable authorship? 50% think it's transparent discussion and agreement on the papers, and then the other 50% thought building research onset of the consortium building. And then also the questions around postdocs, we have only 33% being having experience with postdoc position. I should have voted and it would take it up. And then with regards to the biggest barriers, most people thought lack of funding, which is 67%, and only 17% thought was inequitable access to positions. That's it for me. So I'm going to hand over to Ayat and Francisco.
Thank you, Gina. Thank you, speakers. Over to you, Francisco.
Thank you, dear colleagues. Just closing remarks. First of all, to thank our wonderful presenter, for this really interesting sharing of knowledge and also experience from the very interesting program that are being developed. We have learned so many interesting things. Especially, I would like to remark the wonderful exchange that we have from the programs coordinators or the people who is responsible to deliver and design these programs, but also very well complemented with the experience that people who were part of the programs, these students, perspective was really valuable in this session. There were some things that we can rescue from that, especially where it's related to the expectations of someone who goes through these kind of programs. And someone mentioned, I think it was Whitney, about networking, the experience you get, and the content itself, and also the challenge that you have when you are embedded in these different settings, because you become part of the different dynamics that are being live are being held in these different settings. The fear to stigma and discrimination that health workers experience in these settings also can be transferred to the researchers because of the difficulties that can be experienced there. So I really want to thank everybody once again for this really interesting session. And we are just looking forward to keep going to these different kind of activities. I think we are out of time right now, so I have to close right here. But once again, thank you everybody, and also thanks for all the public we have during the session. And it was really interesting to deliver this to you. Bye, everybody.
Thank you. Bye-bye.
Bye-bye.
Thank you.